remember, we're downstairs now in the lounge. We're going to do our exercise. Are you ready? La, la,
la, la. Kay has always loved to sing, but dementia is gradually eroding her ability to care for herself.
Are you singing again? We're having a little rest.
Luckily, she has her family to support her.
We take her to church. She goes to the day centre. She goes to music group. She does music at home.
But it takes its toll emotionally and financially.
If you want care at home and you're paying for care, it's very expensive. The worries are that financially, will we have enough money to pay for her care? So it's a stress for me because hopefully I'll be here for many more years, but my finances are dwindling and nobody obviously pays me.
Nice to meet you. I'm Andy. I'm Andy.
This morning, the Prime Minister visited a care home in North London.
You are the local candidate, are you?
Oh, no, I was a local candidate.
Though some are still unfamiliar with our new leader.
No, I'm now the Prime Minister.
You what?
He's the Prime Minister.
What, a new one?
Another one.
But I keep changing every time.
I know.
Andy Burnham, whose dad has dementia, is pledging to fix our social care system, speeding up an ongoing review, improving staff pay and training, and holding cross-party talks.
It's a major dereliction of public duty that Parliament has not faced up to this, of all challenges, something so fundamental. I'm going to stick this out. And why am I going to do it? Why am I going to do all of those things for my dad and the millions like him up and down the country? Thank you very much.
Yesterday, we broadcast allegations of abuse and neglect of disabled people at one care company.
ITV News has revealed some shocking failures in social care. You saw that in our report that was broadcast just last night. Can the government realistically transform social care without raising taxes?
I'm pleased that ITV has exposed some of that poor practice in recent days. Is it possible? I think more is possible from within existing resources. But I think some of what we would want to do in the fullest sense will require difficult decisions.
ITV News has spent months investigating so-called corridor care in our hospitals. Today, the Prime Minister pointed to this problem as evidence of the broken social care system, piling pressure on NHS services.
For years, social care reform has been kicked down the road, too politically difficult. The fact the Prime Minister is taking this on so soon reflects his priorities. But to succeed, he'll have to answer the most difficult question of all. Who pays?
Sit down now there.
Members of the public, like Claire and her family, will now be able to submit their opinions on how to build a national care service. Rebecca Barry, ITV News.
Well, the Prime Minister called for cross-party cooperation to help with his proposal to reform social care. He held talks with the Tories and the Lib Dems, but other major parties were not invited. Now, funding of any such plan is likely to be a major issue. Our UK editor Paul Brand is here to look into what are likely to be the options and the priorities. Paul.
Yeah, Mary, this isn't the first attempt to reform social care. In fact, we've been here 22 times before in the last 3 decades. Andy Burnham says he would never forgive himself if he failed again because of the unfairness of the current system. At the moment, people pay for their care if they have more than £23,250 in assets. Below that, they begin to get local authority funding. Many have to sell their homes to pay for their care, of course. Others rely on family members, as we've seen. There are 5.8 million unpaid carers in the UK. These are some of the past attempts to reform the system that the Prime Minister could revive. First of all, his own idea in 2009, a 10% tax on all estates after death, which would replace inheritance tax on the more wealthy. His speeches back then did sound somewhat familiar.
It is important that we do not flinch from this debate. A failure to act would mean a future of increasing pressure on services, a decline in the quality of care we can offer the most vulnerable.
Well, that idea would raise the required £18 billion for a new national care service, meaning care would be free at the point of use. But that idea was dubbed a death tax and helped cost Labour the 2010 election. Since then, other governments have had a go. Remember Theresa May in 2017 during that election campaign, saying that people should only pay once they had less than £100,000 in assets. But that was dubbed the dementia tax, which she quickly watered down without ever admitting it.
Nothing has changed. We are offering a long-term solution for the sustainability of social care for the future.
Her successor, Boris Johnson, had a different solution, boosting funding through a new health and social care levy, 1.25 percentage points on national insurance. That was later scrapped, though, despite similar optimism when he entered number 10.
I am announcing now on the steps of Downing Street that we will fix the crisis in social care once and for all.
So, look, we don't know which model the new Prime Minister favours yet. He said today the sector could do more with the money it has, but also hinted at difficult decisions, possibly code for new taxes. If we really are, Mary, to value care more, then I think the reality, though, is that we are going to have to pay more for it too.
Paul, just to take you on to another step on this, the Prime Minister is saying that tackling social care should happen before any assisted dying legislation is considered. Is that right?
Yeah, and these two issues are linked because opponents of assisted dying have long argued that you shouldn't bring in assisted dying until palliative care and social care are both properly funded and reformed. Otherwise, assisted dying might not always be a genuine choice. People might feel they have to opt for it because they haven't got the right support, the right pain relief. Today, Andy Burnham essentially sided with that argument, saying he does not want to debate assisted dying until there's been proper reform of social care and palliative care. Supporters of assisted dying say it's possible to do all these things at once. That has been done in other countries, but I think this does change the dynamic ahead of the next vote on assisted dying. The bill's coming back again for a second attempt on September the 11th. The last Prime Minister supported it, propelled the bill. This Prime Minister is far less supportive and could well act as a drag on the bill, I think.